Now, the question is, how do we get to the other side of pain? How do we get to being pain-free? And the answer is sometimes you don't. And that's the hard truth. I had a conversation with a patient yesterday, and over the years, I've had this conversation quite a few times. When people are in pain, they get desperate. We get desperate. I can say we because I've been in pain before too. You want answers. You want to know what's causing the pain. You want to know why the pain is sticking around, and you want to know how to fix it. There is a sense of desperation. I think that's a good way to describe it, because oftentimes pain doesn't come from a specific source. It just comes out of nowhere. One day you wake up and there's an ache or something stiff, and then quickly or progressively it can turn into something that's debilitating. And the problem is that there are no clear answers usually. Even if you've had something traumatic, so you break a bone, well, yeah, that probably caused the pain, but that doesn't necessarily explain why the pain lingers for so long after. And I think a lot of people, because they want answers, they'll look for imaging. So they want the X-ray or the MRI. And again, that's totally logical. And I get it. You want answers, so you look for imaging. Imaging findings, unfortunately, don't necessarily correlate well with pain. Not always. There are plenty of people out there who are in excruciating pain, and they've gone and got imaging, and the imaging is completely clear. And there are people who are in very mild pain, and they have some pretty severe findings on an image that you would think would cause more pain. I'm not saying that imaging is useless. It's actually quite useful if it's used appropriately. An analogy that I think works well for most people is chronic pain, especially really intense chronic pain, can be like a fire alarm that goes off with steam from a shower. Now, we can't go out and buy a new central nervous system, but we can recalibrate it. And that takes time, and it takes effort, and it takes consistency. And unfortunately, it takes a lot of frustration and a lot of work, but it can happen. Even if you have tissue damage, your body's going to heal. 100% guaranteed, your body will heal. But even when your body heals, it doesn't mean the pain is just going to magically disappear. Now, the question is, how do we get to the other side of pain? How do we get to being pain-free? And the answer is sometimes you don't. And that's the hard truth. Promising someone that there's a pain-free solution, it's not genuine. It could happen. It does happen for some people, but for some people, they're never completely pain-free. So we look then at the things that you want to be able to do, the things that you can't do right now, or the things that you can't enjoy. And we work on those, and we try and make the quality of life better. We try and improve your quality of life, because pain is terrible, but disability comes when you can't do the things that you want to be able to do or the things that you need to be able to do. So we can work on disability while we try and calm down the pain. And the way we work on disability is getting you back to the important things, getting you back to the fun things, trying to find ways to get you back to a normal life. Unfortunately, cookie cutter solutions don't really work well for chronic pain. It doesn't really work well for athletes who are trying to get back to sport, or active people who are trying to get back to their active lifestyle. Everyone's pain experience is unique. Everyone's injuries are unique. Everyone's bodies are unique, and their lifestyles are unique. Everybody needs something a little bit different, a little bit special. Now, are there quick fixes for things like this? Yeah, for some people. But if you're still listening to this and you're struggling with chronic pain, you haven't found a quick fix, and you might not. And that doesn't make you abnormal. It doesn't make you broken. It means you're human. It's very normal, or I should say it's very common. I love the idea that pain is a request for change. And I think this whole process of dealing with chronic pain is a process of taking a step back, looking at your life, looking at the events that led up to the pain or the events that led up to the injury, and asking what changes need to be made to get the pain under control, what changes do need to be made in order to get you back doing the things you want to do, and then what changes need to be made long term to reduce the likelihood that something like this happens again. Now, pain and injury is always going to happen again. We can't stop that. But does disability have to happen again? Maybe not. So it's complicated, but it's something that we can work through, and there's no shame in needing help. The secret sauce to getting what you want oftentimes is a coach with a plan. There is an excellent solution to the problem that you're dealing with, and sometimes it's helpful to have someone guide you through the process to help you find that excellent solution. And then if you overwhelm your problem with that excellent solution, while you have a coach, while you have a guide, you can't fail.